If your legs start aching, cramping, or going numb after a few minutes of walking, and the symptoms ease when you sit or lean forward over a shopping cart, that pattern points toward lumbar spinal stenosis. The relief on leaning forward is the useful diagnostic detail. Pain from the spinal canal narrowing typically worsens with standing or walking and gets better with flexion, and vascular leg pain does not behave that way. That is why the question, does bending forward help, gets asked so early. Spinal stenosis develops when the spaces within the spine narrow. It happens most often in the lower back and the neck, and the narrowing creates pressure on the spine and the related structures. For most people, symptoms develop and progress slowly over time. And some people have no symptoms at all. That last point deserves more weight than it usually gets, because it changes how a scan should be read. Narrowing visible on a scan is not automatically the explanation for your symptoms, since narrowing exists in people who feel nothing. A report that says stenosis is a description of anatomy. On its own, it is not a diagnosis of your pain. Here is what it tends to feel like, depending on where the narrowing is. In the lower back, the symptoms include pain in the buttocks, radiating into the legs, that typically worsens with standing or walking and improves with leaning forward. There can be numbness, tingling, or cramping in the legs and feet, which may become more pronounced on standing or walking. And there can be weakness in the legs and feet. Why does leaning forward help all? Flexion opens the space in the lumbar canal. Standing and walking make the symptoms worse, and bending forward makes them better. That is one of the more useful clues in the history. And it is exactly the kind of detail patients assume is too small to mention. People often describe a walking distance that shrinks over months. Comfortable for a block, then half a block, then only across a parking lot. That distance is worth tracking because it is a more honest measure of change than a pain score. If you are coming in to be evaluated, write down how far you got and where you had to stop on ordinary days. That record tells a clinician more about how you are changing than a pain score does. In the neck, the picture looks different. Cervical stenosis may cause neck pain, numbness or tingling, radiating down the arms into the hands, and weakness in a hand, arm, or fingers. Hand symptoms with neck involvement are a different problem from a wrist problem, and the two are regularly confused. If your hands have been treated as a wrist issue and nothing has changed, the neck is worth considering. Who develops this? Anyone can develop spinal stenosis, but the chance increases with age. It can also occur in younger people who were born with a narrow spinal canal or who have had a spine injury. So a younger age does not by itself rule it out. Stenosis most commonly develops in the lumbar and cervical spine, which is to say the lower back and the neck. Now, the part that changes what happens next. Because narrowing on imaging is common and not always symptomatic, the useful step is testing whether a specific level is producing your symptoms rather than treating whatever the scan shows. The useful step is testing whether a specific level is producing your symptoms rather than treating whatever the scan shows. A diagnostic block anesthetizes one target and observes the result. Nerve conduction testing can separate nerve root involvement from a peripheral nerve problem. The purpose of both is the same. Find out which structure is actually generating the pain before anything is aimed at it. At the Padda Institute, that approach is described on our pages for electrodiagnostic testing, selective nerve root block, and epidural steroid injection. Where scarring from previous surgery is part of the picture, epidural lysis of adhesions and failed back surgery syndrome are the pages to read. And why imaging alone cannot settle causation is covered in our article on what imaging can and cannot show about pain. One more question that comes up almost every time. Do I have to have surgery? That is a decision made with your surgeon, not a foregone conclusion. Image-guided options aimed at a confirmed target are described across our range of pain treatments. So if leaning forward over a cart is the thing getting you through a grocery store, say so out loud at your appointment. It is a real clue, not a quirk. To have walking-related leg pain evaluated, request an appointment at painmd.tv/appointment. Call 314-481-5000 or text 314-886-5902. We have two locations, 4477 Woodson Road, Suite 100, in Street Louis, and 12174 Natural Bridge Road in Bridgetown. no referral is needed, and you do not need to be an existing patient.